Hi everybody, Dr. Michael Horowitz, owner of Vancouver Orthotics, and today I wanted to create a video to talk about a very common complaint and concern that comes into our office, and that is plantar fasciitis. Now you might have heard of that term before and you might not have, but basically if you're experiencing heel pain or arch pain, especially in the morning when you get out of bed, first few steps, or as the day goes along, or from a seated position, standing and walking. If you feel pain in your heel or in the arch, you may be experiencing plantar fasciitis. It's probably one of the most common symptoms we see here at our office. So common questions come up: how can I treat this? These types of symptoms can often be chronic, meaning that they last weeks, sometimes even months. And so the question is, what can you do to help improve this condition? And for that purpose, I created 16 different things that you could consider or you could do in order to treat your plantar fasciitis. So I've written this out over here, and I'm just going to, in no particular order, but a lot of this is common sense. But number one, if you're experiencing this heel and arch pain, then number one, rest. Don't work through the pain. Where possible, do everything you can to just rest it and get off of that foot. Because the more you put pressure on that foot and that heel, the more likely the symptom will persist. Number two, activity modification. So if you're someone who's doing a lot of walking, or if you're doing a lot of running, jogging, jumping, dancing, or high impact sports activities, that is only going to trigger and make your plantar fasciitis worse. So you do need to consider what things you can back off of in order to give your body and your feet a chance to heal. So the third way is to monitor the number of steps you take a day. Now, obviously walking and movement is very good for you. We're encouraged to take 10,000 steps a day, but when you're feeling arch and heel pain, that's probably not a good idea. In fact, when you're experiencing those symptoms, I recommend that you monitor your steps and try to minimize the number of steps a day you take to 5,000 steps or less. Now, if you have a smartphone, you might have the health app, which monitors and can actually tell you how many steps you're taking a day, assuming that your iPhone is with you and on you at all times. Or you can get a pedometer or other devices that measure the number of steps that you're taking a day, but please monitor that. And if you start to notice that you're taking 14,000 steps and 20,000 steps, and then you're asking yourself, why do my heels hurt me? This may be part of the issue. You're not giving your body a chance to rest and recover. So the fourth way is to evaluate your footwear. Now, we all have many different types of shoes, right? And some shoes are more supportive than others. You might find that one morning your heels really hurt you, and if you take a look at the shoes you're wearing the day before, you might notice a lot of interesting information. This is an example of a good orthopedic shoe. Has a lot of good heel support in the heel, also through the base of the shoe. I have what's called a shoe test. It's a 3-step process where the first thing you do, you squeeze the heel, make sure there's good stability there. Number two, you bend the shoe, make sure that it's not falling in. So there should be a good base of support around the base of the shoe. And number three, twist the shoe, right? Twist the shoe and see if it crumples. A shoe that doesn't provide enough stability is not going to help you as you move your body through the day. A fourth part of the test is when you push the ball of the foot, and if you notice that it's too soft, you might be experiencing ball of foot pain. Well, that's a different condition than plantar fasciitis. So that's called the shoe test, and I can't tell you how many of our patients come in with these shoes that are just not supportive. And when a shoe's not supportive and yet you're standing in it all day, or you are walking in it or doing a lot of activity on that shoe, you're going to continue experiencing these symptoms, right? So number 5 is evaluate your feet. Since your feet are the foundation, it's so important to have your feet properly evaluated. Now, that's pretty much what we do here at Vancouver Orthotics. We take all of our patients through a 3D foot scan, as well as a few other orthopedic tests, and an electronic walking and standing gait analysis. Why do we do this? Because it gives us a great deal of information of what the feet are doing well and what they're not doing well. So a foot is made up of 26 bones. Each foot is made up of 26 bones, and the alignment of your feet is essential, especially when we're trying to make improvements to your biomechanics and how your feet feel. And if the feet are not lined up well, the heel, or the calcaneal bone right over here, makes too much impact to the ground and ends up absorbing instead of dispersing that weight. Now, if you're a 150-pound individual and you're taking 10,000 steps a day, so 150 times 10,000 steps a day is 1.5 million pounds of pressure through your weight-bearing joints. What's a weight-bearing joint? It's your foot, it's your feet, your ankles, your knees, your hips, your back, and your spine. So the fifth way is to have your feet properly assessed, and again, that's one of the things that we do. And when we determine that something's off in terms of stability to your foot, we'll recommend a pair of custom orthotic inserts. The benefit of a custom orthotic insert is it helps change the body's ability to shock absorb. It helps disperse pressure through the heel and through the arch. Orthotics can be used into your sport shoes, into your flats, into your high heels even, into your work shoes, ice skates, rollerblades, etc., etc. But custom orthotics provide spring and shock absorption, and they're a great way. In fact, they're the pillar of support towards helping fix and helping heal that condition of plantar fasciitis. That's number 5. Number 6, you want to be stretching, right? You want to be stretching your hamstring muscles and your calf muscles. Those are the muscles of the back of the leg and the back of the thigh and back of the leg. The importance of stretching those muscles is because the tighter they are, the more likely they're pulling on your heel and pulling on your foot and affecting the biomechanics of weight distribution and shock absorption, right? So one way to stretch the hamstring muscles while you're sitting is straighten one leg, bend the other, and then lean towards that knee or towards that ankle and just feel that stretch behind the leg. Hold for a good 15, 20 to 30 seconds and then switch sides, right? You can also do that standing up against a wall where you basically step and keep one heel back and one leg forward and lunge, gently lunge forward. Feel that pressure behind the leg and behind the calf, okay? Stretching is an important way of treating plantar fasciitis. I just don't believe that stretching is the way to solve the issue. Certainly it'll provide a lot of relief. If your occupation requires you to stand a lot, 6, 8, 10 hours a day, there's a really high chance that your hamstrings and your calves are going to be incredibly tight. All right, so stretching is very important. Massage, right? If you have at home a tennis ball or a lacrosse ball, so for example, this is a lacrosse ball. If you have a stress ball or if you have a tennis ball, what you want to do at the end of the day with a bare foot is put this underneath your foot, underneath the arch and the heel, and you're just going to rock and roll gently around that sensitive area. Now, you don't want to dig, you don't want to cause bruising, but what you want to do is stimulate blood flow through those tight muscles and the tight fascia. You know, fascia is fibrous tissue that can become inflamed and is also often the source of plantar fasciitis. So that is why it's called plantar fasciitis. Itis is Latin for inflammation. Plantar is the bottom surface of your foot, and fascia is the fibrous tissue that gets inflamed. And in fact, that fibrous tissue attaches to that calcaneal bone right on the bottom surface right here, and it's pulling. And those micro tears create inflammation, create pain, and that's where the pain is coming from. And the reason the pain doesn't go away easily or quickly is, number one, we don't usually get to the source of the problem right away. And number two, we're on our feet every day. I mean, it's not like you can get off your feet for days at end. We have to get up and move around. So if we're going to do it, we want to do it the most efficient way possible. All right, number 8 is to ice your heel with either ice or with frozen water bottle. You know, you can fill up a water bottle and then roll the bottom of your foot and apply cold. The concept of cold or ice is that it helps to reduce inflammation, and that can certainly be helpful. Again, the problem is that the condition keeps coming back if we don't get to the source of the problem. But icing is a very useful and a very good way to reduce and control inflammation. Right. The ninth way to help improve plantar fasciitis. So icing is not always the most comfortable. What I've done for myself at times is I'll go and I'll put my feet into a bathtub and I'll fill up the bathtub or a bucket with cool to cold water. Not ice cold water, but cool to cold water up to about the ankle, and allow that coldness, that cold sensation to permeate through the foot and the ankle. And you do that for about 5 minutes on and then 5 minutes out, 5 minutes on, 5 minutes out. You do that about three times. And again, the cold is going to really have a powerful effect on reducing the inflammation. As the inflammation is reduced, the pain can really go away, because inflammation is often the source of the pain. So that's the cold foot bath, which is really good. Now, when the pain is really bad and it's been really chronic, the 10th way, as a short-term method to help control the pain, is to take a non-steroidal anti-inflammatory. For example, ibuprofen, Tylenol, naproxen, non-prescription, taken short-term. Why? Because we don't want you to rely on these medications. We don't want you to take that medication so that the pain is gone and then you go walk 10,000 steps and then the next day you're in pain all over again. So it's only so that you can get through the day and function and reduce some of that horrible sensation of pain. And you do that for a short period of time. When I mean short period of time, maybe 3 to 5 days. Try it out for 3 to 5 days and see how your body responds to that. They are anti-inflammatories. Again, if we don't treat the source, though, then the pain keeps coming back. Okay. The 11th way is to go get a leg and foot massage, either by a registered massage therapist or a body worker. But how good would that feel when someone gets their hands onto your calf muscles and onto the muscles and fascia on the bottom of your foot and apply pressure to those sensitive, tense areas, right? When we hold tension in our neck and our shoulders, it feels good to have that pressure to those areas of our body. And the same thing applies to our feet and to our lower leg. The concept of massage is it stimulates blood flow. Blood brings oxygen and glucose and flushes away lactic acid and other inflammatory metabolites, which promote the pain and the discomfort. So massage is always a great thing. Number 12 is try the Hypervolt percussion massage. Here at our office, we have one of those. It's not with me at the moment, but it's a device that provides vibration, percussion, at a very high intensity and frequency. Of course, we control the amount of pressure that we use, and we apply that pressure to stimulate that blood flow and reduce the tension around the arch of the foot, around the heel itself, and around the lower leg muscles. If we can get those lower leg muscles to relax, there's going to be less fatigue and less pull on that plantar fascia and that heel. So that's the percussion, and that is a service we offer here at Vancouver Orthotics. Number 13 is try IMS. IMS is intramuscular stimulation. It's where a physiotherapist, for example, would use a needle to create a contraction of the muscle, which is followed by a relaxation. And if you need a recommendation in the Vancouver area for a great physiotherapist, I have someone that I can recommend for you, and he does IMS treatment. Number 14, use a non-prescription ointment such as Voltaren, or we recommend here at the office BioFreeze, but a cooling gel or ointment that can be applied under the arch or the heel. Use it 2-3 times throughout the day. And the concept again is blood flow and reduction of inflammation. All right. Number 15 is try a prescribed ointment that your family doctor or physician would recommend, such as diflucan. There's others out there, but again, maybe a bit of a stronger anti-inflammatory that can be used from the external surface. Okay. And number 16, the last one. 16 happens to be my lucky number. It's why I came up with 16 ways to treat plantar fasciitis. Is a reminder of getting to the source of the problem, and that is having your feet properly assessed with a 3D foot scan, an electronic gait scan. Allow us to figure out what your feet are doing well, what they're not doing well, where are you shock absorbing when you should be shock dispersing, and then coming up with the appropriate custom orthotic insert that goes into your favorite shoes. We'll make sure that it fits those shoes really well, and that orthotic will give you proper bounce, proper stability. It'll support the 4 arches of your feet. It'll support the 26 bones of each foot, and I mean, really, to me, this is the pillar of how we help people with this condition: heel pain, plantar fasciitis. Oh, a common question is, how do I know if I have plantar fasciitis or a heel spur? The only real way to answer that is to have your foot x-rayed. An x-ray is the definitive way to determine if there is spurring of the heel or the calcaneus. Even if there is a heel spur, we know that the pain isn't caused by the spur, it's caused by the inflammation. So really the same 16 methods of treatment for heel spur is applied for plantar fasciitis. Notice I haven't spoken to you about cortisone injections, I haven't talked to you about surgery, because the type of work that I offer is the non-medicinal, non-medication, non-surgical approach to treating these issues. Right, and that comes from my background education, is always treat the source of the problem and try not to use a hammer when all you need is a little bit of maybe a screwdriver. So there you go. Once again, it's Dr. Michael Horowitz of Vancouver Orthotics. Please visit our website, which is vancouverorthotics.ca, for more great information about all the different aches and pains that you might be experiencing. Through that website, you can book an appointment online if you'd like. You can give us a call at 604-737-3668. Send us an email if you want with any questions that you have. Happy to be of service. Really want to help people with this condition and other conditions. And I hope this video was really useful for you. So thanks very much, everybody, and have a great day. If you like this information, please subscribe to my YouTube channel. There's a lot more great videos that we're going to be sharing and sending out. So have a great day, everybody, and talk to you soon.